Meanwhile, the Women Advocates Research and Documentation Center has presented a film in a bid to broaden the understanding of the implications of the suspension of clinical guidelines for safe termination of pregnancies by the Lagos State government. Kemi Foladiemo has more.
Following the example of the Federal Ministry of Health in releasing the 2018 National Guidelines for Safe Termination of Pregnancy within legal indications, Lagos State went on to release expanded guidelines in June 2022. But the guidelines were put on hold shortly after on grounds that the consultation process wasn't inclusive enough. With this latest intervention through the power of film, stakeholders say it's important to allow for safe abortions as incest, gender-based violence and deaths from unsafe abortions are on the rise.
It might not be an emergency as the law will call it. We're not saying that there should be, unbridled law that allows for people to die, because oftentimes that's what people think. But what we have realized over time is that where there are laws that are liberalizing, you will see that maternal mortality will reduce, and that's all those developing countries can be examples for this.
What you see visually impacts positively on the stories that you hear. So I believe that this is a veritable tool to propagate change, and that people will learn more and understand it, and that the government themselves, having watched this, will actually feel committed towards lifting the suspension.
The movie, If It Were You, also depicts the realities women and girls face when combining pregnancies with serious medical conditions such as kidney, heart or psychiatric diseases or cancers.
Thousands of women keep losing their lives or suffering long-term health implications. Some of them could either be, yes, as a result of maybe some of our policies or lack of those policies. Your theme today of Toba Shewo reminds us that our efforts must be holistic, they must be inclusive, and they must be very proactive if we are going to prevent more maternal deaths. Therefore, I call upon each and every one of you, let's join hands together to continue to strengthen advocacy.
We believe that access to safe reproductive health services is not just a health issue, it is a fundamental human right. We advocate for better health systems, better policies, social change that ensure every woman can access care without fear or stigma, or even danger.
The stakeholders believe more advocacy will help save lives and have a positive impact on reproductive health care in Lagos. Kemi Foladiemo, TVC News, Lagos.